So what of somebody that has delivered with CS and the person still sick?
She's saying what of somebody that has delivered with CS before? Can this person still see show? Now, if you deliver for CS 3 times, usually we don't go through the cervix. So we are bringing the baby out of the without the cooperation of the cervix. So that person can see show as much as he is pregnant. I don't know if you understand. The show, not seeing the show, is actually a function of the fact that the holding chamber for the show is now open. So nothing is holding the. Some of them might still see the show if the show is somewhere, they can still see the show. But I'm just telling you, the show is just like a plug, something that covers the cervix. So what will now cover the cervix if the cervix is already open?
A lot of diarrhea, I have that diarrhea is this sign of labor.
She's saying diarrhea is sign of labor. What I'm saying is anything can be sign of labor. In fact, a woman that stays and starts shouting on the husband is also a sign of labor. I don't know if you understand. A woman can suddenly become aggressive. There is what you call postpartum psychosis. Those people, once they take in and they deliver, they will have some degree of mental condition. I don't know if you understand. Now, there are some women that have, they take in, and what their own postpartum psychosis or pregnancy-induced psychosis was supposed to happen 2 months after they deliver or during their time of labor. If they take in now and have a miscarriage, 9 months from that time they have a miscarriage, they will have that postpartum psychosis. I don't know if you understand. They didn't have the baby, but from the time this placenta was formed, it was already programmed that 7 months from now, because the baby is at that time 3 months, it will be programmed that 7 months from now, this woman is going to have this disease. But the pregnancy did not then go to completion. 7 months from that, even when there was no baby, the psychosis will happen. But it might not be as severe as it will if the whole thing is there. So most women, once it reaches close to that time, they will deliver. Those things that were supposed to happen will start happening. Diarrhea can happen. You know, the labor is just contraction. And the contraction is the contraction of what? Smooth muscle. I don't know if you understand. Now, the womb is a smooth muscle. The large intestine is also a smooth muscle. So some people, once the womb starts contracting, everywhere starts contracting. And some of them will start going to toilet. In fact, during the time of labor, when you are asked to get requirement, you are asked to get pad. And you also asked to get what? Tissue. Big one too. Because most people that are in labor will start passing feces. So sometimes you keep on removing their feces even when the baby is still not there. And sometimes even at the two, no, that is the preparation. You just roll it and wait for the feces to come. Because the contraction of the smooth muscle does not know. In fact, some of them, when they are transiting from passive phase to active phase, the moment they reach 8 cm, they start vomiting. It's normal because the whole thing is contracting. So any food that cannot be pushed down, the pyloric sphincter will push up. Nothing is going to stay in the stomach because it's contraction. Everywhere is contracting, including the smooth muscle. Every smooth muscle in the body is contracting.